In this video, I'm going to go over why you have chronic pain in your neck and in your back, and why chiropractic can help, and how chiropractic can help. That's if you're interested in actually treating the root cause and not just covering up symptoms. Now, chiropractic care goes a lot deeper than just helping with pain. It helps with a lot more things, but for this video, that's what we're going to focus on. Now, I really hope you have the patience to really listen and really understand what I'm going to go over here, because it could change your health, it could change the health of your loved ones and people that you know. Now, let me start by saying that most people think it's muscles. They have back pain, neck pain. They're like, oh, it's muscle tension, it's muscle pain, because they feel the muscles, and there are pain receptors in muscles that tell the brain that there's pain and there's something wrong. But it's rarely actually the muscles that are actually the problem, unless you acutely injure the muscle with a strain or like an exercise injury or sports injury. The root cause isn't the muscle. The cause is most likely coming from your spine, the joints in your spine. And there's mechanisms that explain why this is actually happening. Now, besides the mechanism from just muscles being painful, inside the joint there's two main mechanisms. One of them is the biomechanics, meaning the motion of the joints in the spine and the alignment of those joints. And then the other one is inflammation and inflammatory processes in and near the joint. Okay, starting with the biomechanics and the alignment of the spine. Inside the joints of the spine, there are mechanisms. There's nerve ending mechanisms, just to put it in layman's terms, that will tell the brain that something is wrong. The way that it's set up, without going into all the science, is that if we don't have complete range of motion with the joint surfaces, that's what my hands are trying to portray here, and alignment of those joints, there are nerve ending mechanisms that tell the brain there's something wrong. And if it gets through to the conscious level, you start to get, you will get pain. So the body will start to, will send those signals to the brain, but when they reach a certain level, you will actually have pain. Now, the inflammatory mechanism is you also have receptors in and around those joints that if there's inflammation in there, that will tell the brain pain, because again, pain is just telling your brain something is wrong. So whether it's alignment, movement, or inflammatory processes trying to heal, then your brain is going to be told by your body and your joints pain as a way of saying, hey, something is wrong. Now, diet actually has a small component in this as well. If you have an inflammatory diet, you can have, and you have chronic inflammation, that can contribute to chronic pain as well. So going into the explanation of muscles. So, people have, when they have neck pain or shoulder, or, shoulder, base of the neck pain, they're like, oh, like that muscle, it hurts, it's painful. Well, the only reason that's going to be sore or painful is, well, one, if you did a workout the day before, or if your spine and your body is trying to hold your body in a certain position because of either poor posture or because you don't have proper function in your spine, then those muscles are going to tighten, and then they're going to be tired, they're going to be achy because they're being overworked. Now, that's to say the muscles aren't the actual cause of the problem. The muscles aren't going to contract and spasm and protect and hold if the nerves don't tell it to. That's a super important point to understand, because muscles are slaves. They're only going to do, if a nerve tells it to fire, it's going to fire. If it doesn't, it's going to relax. So a lot of people treat muscle pain, muscle achiness with medications or whatever therapies they're going to use, but that's not actually the cause of the problem. And again, unless you do a major workout and you're trying to decrease inflammation, which is a whole nother topic as far as working out and recovery. But I'm not gonna address that right now. Point is, pain from the muscles is not the core problem. So when we look at it and we look at the spine, the mechanisms of the spine not moving properly and not being in alignment. The question is, why aren't they? Now, it's some degree of physical injury, whether it was a car accident, whether it was a slip and fall, whether you slipped and you hit your head super hard and it hurt your neck when you were 12, when you were 19, 20 years ago. These things don't get better unless they're addressed. They will get worse over time unless they're addressed. They might get worse over time anyway, but chiropractic care can help with that. I'm going to get to that in a moment here. But it's essentially physical injury to the spine and the joints that are going to create these issues. Another way that the spine could be injured or have physical symptoms or cause an issue inside the joints is poor posture, repetitive, asymmetrical movements can also cause pain. That's why a lot of times when you're sitting on the couch in a certain position and then you get up, well, you're putting your joints in a compromised position, and then when you move, the body's going to tell the brain, whoa, like we're not functioning really well here. So you're going to be achiness, it's going to be tight, your muscles are going to be spasmed. So now we understand the cause of why these problems are coming from the spinal joints. Now the question is, how do we fix that? That's where chiropractic care comes in. This isn't a soft tissue thing. This isn't a rehab, massage therapy, physical therapy, stretching, strengthening problem. This is a in the joint problem, and that's where chiropractic shines, because chiropractic adjustments get complete range of motion restored with the forcing of those joints to move, and we also get things in alignment the way that the body's supposed to be. So when we can restore that normal function, the receptors in the joints that tell the brain something is wrong don't need to send signals to the brain to say something's wrong, because it's being restored. And that's when pain decreases, because the body doesn't have the need to tell the brain that something is wrong. So that's what we mean by addressing the root cause. That's how chiropractic care helps with chronic pain, neck pain, back pain, and getting things back to restoring the way that it's supposed to. And it does this through the nervous system. Through the nerve system. In the joints, there's nerve involvement in the joints that communicate with the brain communicates with the muscles in the joints. It's all a circular process that happens. Now, I practice a technique called NUCA, and that is designed to align everything through the spine, the entire spine, through the upper neck, to align it and get range of motion back to normal the way that it's supposed to be. And often I get patients that have either heard of a friend or family member who went to a chiropractor, didn't have good results, or they went to a chiropractor and they said, oh, he made me worse, or she made me worse. I don't really go into that detail, but I highly suspect that what happened with the patient is when the chiropractor gave the adjustments and they broke up the adhesions and scar tissue that were causing the dysfunction, that created an inflammatory process. That inflammatory process increased some pain momentarily or temporarily, and the patient viewed that as, oh, he made me worse, or oh, I got worse after I got adjusted. It hurt me. Well, the most likely mechanism of what happened was they didn't get worse. They were just symptomatic through the normal process of the body healing by increasing the inflammation to clear out the adhesions that were broken up during the adjustment. And this is important to understand. It's very hard for a chiropractor that's even doing the manual adjusting to hurt somebody. If they're a professional and they've been trained, they're not going to hurt anybody. And oftentimes we actually need consistent treatment. Not often, almost always, the person needs consistent treatment to break up those adhesions, to retrain the spine to be back in alignment, because most of the time patients haven't had this care throughout their entire life, and they should have this care throughout their entire life. This is taking care of your spine should be like taking care of your teeth. It's from day one, and the world will know that at some point. The old term, the truth will out. This will definitely be known. It will, chiropractic will one day be kind of a household thing where everybody just knows they need to go to the chiropractor, they need to get their spine corrected and fixed. Here's the way I explain it. If we have a pie chart, and this pie, it represents everything in our health that we do. Well, a piece of that pie of our healthcare is taking care of our spine. Now, some people, it might be 1%. They don't have too many spinal issues. It's not affecting their health that much. They're very lucky, but that's for some people. Now, some people like me, which my health literally guided me to doing NUCA chiropractic, upper cervical chiropractic, and taking care of my spine, because for me, that piece of the healthcare puzzle was huge. 47%, 79%, whatever it was huge. So people need to have their spine checked. Some people need more care than others, but your spine is involved with your health, especially with neck pain, back pain, headaches, migraines, dizziness. That's what we do when we work on the upper cervical spine here. I just wish everybody knew, and that's kind of what I'm trying to do with these videos, is explain to everybody and the public and the world why chiropractic care can help, the proper kind of chiropractic care. Finding issues in the spine, getting the joints back healthy, removing what we call subluxations, and getting the nervous system functioning optimally through the spine. That's the whole point, that's the whole goal. If you get this done by a good chiropractor and you have chronic pain, chronic back pain, chronic neck pain, you will improve. How much you will improve based on how much damage there is and how young you are and how old you are. There's lots of different factors, but it's essentially taking care of your teeth. If you don't brush your teeth for 40 years of your entire life and you're 40 years old and you go to the dentist, you're going to have some issues, and it's going to be a lot of work to get you back to, but it's going to be, we're going to optimize it. You're not going to get perfect, healthy teeth like if you were to take care of your teeth. It's the same thing with your spine. People go their entire lives not taking care of the spine because they don't know that they're supposed to, and they come in and I have to look at their spine and say, this was a problem for 30, 40 years, 50 years, 60 years. We're going to treat it. We're going to optimize your spine. You should do well, but we don't know how well until we just get you under care, get your spine optimally functioning, getting your nervous system optimally functioning. And so that's the goal. That's the point of the chiropractic care. I hope you enjoyed this video. Please share it with everybody that you know, that you love. It's super important for everybody to have proper spinal health care. It improves people's lives. It changes people's lives. It gives them their health back. It lets them do things that they couldn't do before. Lets them feel better with less pain, less health issues. So help me spread the message, please. Comment, like, subscribe, all that kind of stuff. Please help me get the word out. Help me help other people and spread the message. I appreciate it. I'll talk to you soon.